Welcome to the Clinical Education Initiative podcast, Conversations with CEI, where we feature conversations with clinical experts, their experience and insights on current health issues in the areas of HIV, primary care and prevention, sexual health, hepatitis C, and drug user health.
Hi, everyone. Welcome to the podcast today. We're going to be having a conversation with a person with lived experience of hepatitis C in pregnancy. My name is Kelly Ramsey, and I'm an addiction medicine and internal medicine physician. And I'm going to be having a conversation with our guest today, whose name is Morgan. So first, Morgan, let's go ahead and get started. Why don't you tell us your story with respect to being diagnosed with hepatitis C during pregnancy?
Hi, I'm so happy to be here and to share my story. So I had a son when I was 20 years old, and I was not given any kind of testing. So there was no hepatitis C testing. Really, I think they only checked for your regular levels of things. They weren't doing any kind of screening. I spent a long time wanting another child, not being able to have one. And in July of 2021, I was very unexpectedly pregnant. I had just moved to New York. July of 2020. I had just moved to New York, and I was away from all of my family. I was really nervous. So when I made my first appointment and I went in, my OB explained that she screens for everything, that I was going to be doing blood tests, and she was going to screen for STDs. She was going to screen for, she actually did a pelvic exam. She was going to screen for hepatitis, HIV, all of those things. So about 2 or 3 days later, much to my shock and surprise and dismay, my screening for hepatitis had come back positive. Hepatitis C had come back positive. And my initial thought was that I was going to have to terminate. I did not know that you could have a successful pregnancy with hepatitis C. I knew that there was just no question in my mind that I never wanted to see my doctor again. What was she going to think of me? I was just ashamed and confused. And I didn't know what the next steps were. All I could think was I waited so long to get pregnant again, and I'm finally pregnant, and now it's going to have to end. So the termination was kind of a big thing that was in my mind. So it's just really disappointing.
Must have been really scary for you. What was that interaction like with your medical provider? When she or he shared the results with you?
I give her all of the credit. She handled me with such care and just absolutely no judgment. And she called me, I think maybe a couple of minutes. It could have been 15 or 30 minutes, but it felt like immediately that I saw the results come through my chart that she called me. And she said, "I'm sure you saw, it's fine. Everything is fine." She said, "This is not the end of the world." She immediately relayed a story of another patient that she had, similar to me, that had found out very unexpectedly. She said that she was going to refer me to a fantastic doctor, and she did. And that, obviously I would talk over my care plan, but it was curable. And she just she never treated me any different after that. It was just, "Hey, we're going to send you to this other doctor. You're going to be fine. Your baby's going to be fine." And I can't imagine what it would have been like if I hadn't had that. Just that even-keeled, cool head talked me off of the ledge and really allowed me to continue my care, because had it gone the other way, I may not have gone back to her. I may have sought out, or I may just not have gotten care and terminated, or I may have gone and saw the liver doctor and just not had OB care, or gone to somebody that I was going to go in knowing, and I could tell them up front. I was so afraid of being treated different, and she just never did that.
It sounds, based on that interaction, it really allayed your fears that you would need to terminate. It really normalized it for you and really helped you to feel less stigma around it.
Between Dr. Kushner and my OB, I did not feel stigmatized at all. I'll give you a story, though, of a time that I did, which was when in my pregnancy, as one does, you get sick, things happen, and you end up in the emergency room. When I think they were drawing blood, and I had never had hepatitis before. I didn't know what the rules were. So I thought I was being helpful. And I said, "But, I just want to let you know that I have hepatitis. You're taking my blood. I just want to make sure that it's all the up and up. You can see it in my chart. the change in care and the change in the way that I was treated was immediate. I mean, I don't know any other way to say it unless you have felt that like you say something or you do something and it's just, they're a little bit more cold. They don't come over as often. I was kind of pushed over into a gurney area and left for hours. I actually ended up leaving. I remembered this. I ended up leaving against medical advice, and they wouldn't, like, I couldn't even get them to remove my ID because I was just sitting there for hours and hours. And then after that, there was some impacts that happened afterwards that it just, really left a bad taste in my mouth, but also made me so passionate about how doctors and nurses really need to treat people with compassion and not judgment, because you don't know my story. I don't know your story. I don't know anybody's story. There's a lot of people that have this, and those preconceived notions of where you might get it from, that needs to go out the window, because we're all human and we're all deserving of care. And it can be really impactful when you think about the feelings that go behind being pregnant with a child that might be impacted maybe by your own choices in the past. And what we all want collectively is a healthy baby, a healthy mom, and healthy people.
And it's really disheartening to hear about such a lack of professionalism in a medical professional or a professional in a healthcare setting. We all should be leaving our biases, whatever they are, at the door when we arrive at work, and treating everybody, regardless of whatever medical condition they have or regardless of any other social factors, exactly the same and professionally. So it is really disappointing to hear about that interaction. But obviously, we know, unfortunately, that there are other examples of this in healthcare. So we talked about sort of what a bad experience feels like, and we talked a little bit about what a good experience feels like. But what else do you think in the care that you received, both from your OB provider and from Dr. Kushner, who was your liver specialist, what did they do that made you feel really good about being in their care and that you were getting good care for your hepatitis C during your pregnancy?
It was the consistency in my treatment. It was honestly the consistency of, I could not perceive that there was any negative association, right? So growing up, at least for me, growing up, hepatitis C was you only got it one way, right? And I was so concerned about, what was CPS going to be called? Was I going to have to worry that they were going to start drug testing me? Was somebody going to start digging into my personal life? There was just none of that. It was just, you have it. We're here to treat you. We don't necessarily care how you got it. We just are going to explain to you, this is the way that Dr. Kushner, right? My liver doctor, this is how you're going to go forward. There were a lot of pamphlets, a lot of explanation on things that you can do to ensure that you're not contracting it again, to be safe, things like that. But there was just no, hey, this is what we think you did. Like, it was, okay, here are your options. I mean, and then Dr. Kushner gave me the choice. I highly recommend weighing your own choices, right? So for me, my choice was clear from my first conversation with my OB, but they were just so supportive. They spoke to each other throughout. My OB knew when I had started the medication during my pregnancy, there were some side effects. They were so supportive and so just happy when I was going through treatment. I can't stress enough, I never felt like I was being judged. And that's so important, because to me, especially being pregnant with hepatitis, I felt like I had a scarlet C around my neck. I just felt like everybody knew I was tainted. I was going to taint everything. And it's already such a stressful time that what you really want to do is comfort and care and support that pregnant person so that they can make the right decision for them and their child, and not leave care. Because I was not that person that ever would have thought that I would have left care, but I definitely would have left care. If not terminated, okay. I mean, women have babies all the time. You don't have to have an OB. That was my thought, which is not safe. Obviously, you want to stay under the care of a doctor.
And that's really great information. The other thing that comes through is that your OB facilitated that referral to Dr. Kushner to make sure that you were educated about Hep C and that your Hep C was essentially addressed during the pregnancy. And again, Many people get linked during pregnancy and they have Hep C. Sometimes they get linked after pregnancy. But what you illustrated with your example is how important that linkage is, that it happens, and that it happens in a way that's a very warm handoff so that you feel good going to the provider you're going to see. I'm going to move us to the next question that I want to ask you. So that is, what are the barriers specific to pregnant persons seeking services that you have identified or experienced?
So I think in a lot of areas, they're not testing, right? I think testing for Hep C is something new. I come from Florida. I know a lot of pregnant people that have had pregnancies in Florida and Texas. They simply don't test for it. I had a family member that went through a pregnancy. I think she had been in recovery for about a year when she got pregnant. They didn't test her until she had the baby in the hospital. The hospital was the one that actually tested her. So really the not testing is number one. But number two, while I can't speak from necessarily personal experience, I do think that there is a barrier for people that are active users or maybe don't speak English. There might be migrants that are here or immigrants that are here that they are fearful. They don't want to go into a doctor, and it's really just the lack of access and that fear of treatment. You don't want to be treated as less than, and that is such a strong pull for people that I don't want to be singled out, and I don't want to have a doctor repeat to me all the things that I already know about myself.
The other thing that I think of, and this is what you're alluding to, is stigma. I think it's very difficult for pregnant persons, I'm sure everywhere, but here in the United States, it's very difficult because there is this expectation that the pregnant person be perfect, the perfect pregnant person, and then the perfect mother. And obviously, there is no such thing as the perfect icon of either a pregnant person or a perfect parent. And I think that stigma and that pressure is particularly difficult for pregnant people who use substances or parenting people who use substances, because again, they're sort of simplified into that is the only thing about them. And people don't realize that, again, just because someone is using substances doesn't mean that they won't be a fantastic parent or that they don't love their child. And so, again, you alluded to some of the other situations, such as access to care that other groups may experience as well. And I think it's challenging for people here to be pregnant in general, again, because there are so many, as you said, pressures during pregnancy, and I'm sure fears for a lot of people too. Am I going to be a good parent? Will I have the support I need, et cetera?
I can add on one more thing. In the day that we're in now, or like in this time that we're in with social media, I follow a lot of creators. I follow a lot of people. And the one thing I see people talk about their recovery. I see people talk about access to care. You see a lot of people advocating for a lot of things. And it's very popular to be pregnant and a mom on social media, but there is still such a stigma for hepatitis. And I've even seen creators be open about herpes and HIV. I have yet to see people talk about hepatitis on social media. And that can also further isolate and make you feel that stigma where you talk about wanting to be perfect and healthy in your pregnancy. That's still something it's still even taboo, I feel like, to talk about, because maybe it's just what I'm seeing, but I feel like with as much as I look out for and I follow creators that would talk about those things, it's just not something that's talked about. So I think that further kind of perpetuates the stigma and makes you feel makes you feel more alone.
It's a really great observation. I wanted to ask you about some best practices when we think about hepatitis C and pregnancy. So from the patient perspective, what would you consider best practice for screening for hepatitis C in pregnancy? What education does the pregnant person need, either before screening happens or once screening has occurred and we have the test results?
So before you get tested, there's usually like a list of, hey, this is what you're being tested for. There's like a printout. I would absolutely love if they would include in that, you're going to be tested for hepatitis. You have options, right? So we know that it's, the patient's choice if they want to go through take the medicine while they're pregnant, But I did not even know that it was an option. I had no idea. I had family members since the like 80s that have had hepatitis. It has been around my entire life. I thought I was very familiar with it, but I also thought that it was cured by a liver transplant. I had no idea. So that's where, when I found out I had it, I was like, oh gosh, I'm going to have to get a new liver. I'm not going to be able to have a baby. I might have to get a new liver. Am I even going to be eligible? What's going to happen? So, having that information, even if I didn't read it before I got tested, I would have immediately gone back and looked through. And so I think that's something that's, nice, is a link to resources and information so that you're not doing Dr. Google, right? I'd rather it have come from the doctor. Luckily my doctor called me before I got down the WebMD spiral. No shade to WebMD, but sometimes, it can make you feel like the worst, possible thing because they're trying to give you all of the information. But if you just have it up front, I feel like that would just be so much better. And it might take away some of that fear, because I answered the phone for my doctor. How many people aren't going to answer the phone for their doctor?
Very true.
And that's something I think about all the time, is when that test comes through my chart, how many people just never pick up again?
Yeah, good points. The other thing is, do you think today most people would prefer a written handout, or would they prefer links to websites where they could find accurate information?
I think if it's done digitally, the links to website. I'm somebody that I keep the papers, and so I think it's just a personal preference, but I can't see anything wrong with doing either or both. Anything to actually put it in their hands, so if they want the information, they know where to find it. Hey, we're going to post these links. You can see what tests we're waiting on. We're going to give you these links. Again, it's all digital now. It's all through these apps. Put it on there. Give us, and there may already be this, and this just could be my lack of knowledge, but I do feel like that would have been so helpful for me to be able to immediately pull that up and know.
So I want to go back to talking about the linkage to care piece. So from your perspective and in your personal experience, you opted to do that follow-up while you were pregnant. So you wanted to see the liver specialist while you were pregnant. What do you think most patients would respond, or how would they respond in that situation? Do you think most people would want to get linked while they're pregnant? Do you think some people might prefer it postpartum? What do you think about that?
So I've met people that have done both. They found out postpartum. I had, my family member that found out while she was pregnant, but at the hospital. I think out of the people that I know of, if they have the choice and they know they have the choice, I think most of them would choose to be cured beforehand. But again, that's a personal decision. I think what's going to be the deciding factor on whether or not they go to a specialist is going to be that initial conversation with their doctor, right? That's the only reason that I was willing to go see another doctor, was because my OB was so nonchalant, no big deal. This happens all the time. She relayed a story to me that, true or not, it just immediately made me feel like, oh my gosh, she's had this other patient recently. Okay, so it's not just me. How great is that? So that's so important, because if you feel like you're going to be treated less than, and you're already feeling it from your current doctor, you are not going to take the chance to go to another doctor, in my opinion. I wanted to go in a hole and just never see any of these people again. I was so embarrassed. And there's no reason to be embarrassed. It was because I was pregnant and finding out that made that just so much worse for me, in my opinion. I think it really depends on that initial conversation. And then talk to your doctor. You can do it while pregnant. I will tell you that is not something that I have ever regretted for a single second, because I don't know how long I had hepatitis, but I will tell you, within maybe 2 weeks of taking that medication, I felt so much better. I felt better in a way that I had no idea how run down and sick I was. I was in my, I think, 7th month of pregnancy. So to get that burst of energy and to not be so tired and sluggish, it was like a breath of fresh air for me. I'm living on the 5th floor of a walk up. So extra energy was great later in pregnancy. But I will always advocate for at least talking to the specialist and letting them tell you your options, because you can do it beforehand. You can do it after. You can, how they test the children and things afterwards. So it's all personal preference and what you're okay with. I wasn't going to take that chance. And I was always going to do it in my pregnancy. It was immediately decided as soon as she said there was a cure.
Well, I'm going to just give our audience a few facts before we move into talking about your treatment, because you've alluded to that a couple times. And so I think it's important that we get to that. For one is many people are completely asymptomatic during hepatitis C infection. So they don't notice any symptoms. And sometimes, Morgan, as in your case, they don't realize they're fatigued until they actually get treated, and then they feel better. And then they go, oh, wow, I was really fatigued and I didn't recognize it. It was from hepatitis C. The other thing that I wanted to mention is that currently the FDA-approved medications for treating hepatitis C are not yet approved in pregnancy. However, there have been clinical trials that are looking at the efficacy and the safety in pregnancy. Dr. Kushner, who is Morgan's physician, has been involved in those clinical trials. So I do want to move into your personal experience of being treated with Hep C medication while you were pregnant. How did you decide to do that, and what factored into your decision-making to do that?
So anxiety is the name of my game, and I am a star player. Okay. I get anxious about everything. I have a lot of medical anxiety. Okay. I think I must have asked her probably 30 to 40 minutes of questions with just like listing them out. So the main thing was, I know it's not FDA approved for pregnancy. Explain to me what testing they've done, how long they tracked the children. Okay. Were any of them born missing a vital organ? Were any of them born with development delays? Was there any causation for that? Did any of them have liver issues? And so she really, she was so thorough, and it gave me, she was so confident and so thorough. It really gave me the confidence that I was making the right decision. Some of this may have changed, so I'm not going to go into her answers. I will just tell you that I started my treatment in the third trimester when I believe all of the major organs were already developed. I had already gone through my second anatomy scan, which if you're in New York, they do 2. Some other states, they only do 1. But in New York, they do 2. I'd made sure that all of his vital organs were done. Obviously, the lungs were still developing, but they were all formed. So I was not afraid that there was going to be, a piece of his heart that was missing or something like that going into it. And, I think that it was thorough, and she knew it all, and she was able to explain it. And I just felt like the risks of letting him be born and possibly contracting it, and the time, maybe the time period for when he could get treated, it just didn't make sense to me to not take it. I felt like the risks were lower if I took the medication versus waiting.
Well, another fact I just wanted to make sure that the audience is aware of is that the risk of vertical transmission, which is transmission from the pregnant person to the fetus or to the infant during the birth process, is about 6%. So it is low. It's very low. But in Morgan's case, she made a shared decision-making with her physician to treat during pregnancy for her unique situation. So again, I think it's really important to emphasize the shared decision-making process between the medical provider who will be providing the information on hepatitis C and the patient. So I wanted to address about your infant. So what happened with your baby? And can you walk us through the process of getting your infant assessed postpartum? What did that look like for the two of you?
So another amazing doctor, right? I feel like I had such a good experience across the board. So we picked our pediatrician, and she's also in the same network that my OB and my Dr. Kushner were in. So at my first postpartum visits, I had COVID, and I needed Gideon to get tested for COVID. And then I also explained that I would need him screened for hepatitis. And so she, again, another doctor, she's not looked at me sideways. There was no pause. There was just, okay, well, here's our testing schedule that we're going to do. I feel like she did it at maybe 4 months. I know that I think she started at 4 months, and then We did it at a year and then 18 months. And then the final test that we did at 2, she did it out of precaution, just so that we all had peace of mind. I actually went through a subsequent pregnancy. So that was my daughter that you just saw climbing in my lap. And she will be screening my daughter at her 18-month appointment, just to be sure that something didn't come back, because random things happen all the time in the medical world. And so she's going to screen my daughter. But so, Gideon is perfect and he's had absolutely no issues. It's just a simple blood test that they did. And she just repeated it a couple of times just to see if there was anything going on. But again, like, round of applause for having another doctor that, again, in the back of your mind, you're thinking, is she going to call CPS on me? Are they going to start digging into my whole life? Are they going to think that I'm not taking care of my kids? She was so great that I have my oldest, who's 16. I took him to her to get tested because his father also was hepatitis C positive. And I figured, you had 2 parents. I don't know how long I had it. We don't know how long his dad had it. So we took him to get tested. He was negative, but that was how great my treatment with her was, that I brought my other child in to get tested to make sure that, they're all safe and healthy.
That's great. Would you change anything about the process that you went through with your children?
With my children, no. With me, with my OB and my liver doctor, no. The only thing that I would change, and I've said this, before, is hospitals, the treatment at the hospitals. And I relate what happened with me at the ER. But when I was in labor with my daughter, so a full 18 months after I had gone through treatment, the nurse there was, oh, she's Hep C positive. You're going to have to do blah, blah, blah. And I was, no, I'm not anymore, but thank you. So she was just kind of reading this note in my file, and that you could hear it in the voice, right? So those were the 2 things that kind of stuck out to me. You don't need to say that. And there's nothing wrong with me. There's nothing wrong with my babies. Like, we're good. We're fine. You're in a hospital setting. You're being safe. So even saying that out loud where I could hear it just kind of rubbed me the wrong way. I'm not different. I'm just like everybody else.
And again, for our audience, just to be sure that everybody's following. So when somebody has a positive Hep C antibody, that antibody will remain positive forever.
Right.
So it doesn't change after a person is treated and cured of their hepatitis C. So, Morgan, what would have been appropriate is for the person to ask you, have you been treated for your hepatitis C? And you would have responded, yes, and I cured. And then it would have been a moot issue and your chart could have been updated to reflect that.
Yeah.
Unfortunately, that person didn't ask you that question. And how people...
She wasn't even talking to me. She was talking to somebody else about me, which is what I was like, but my OB was there and she was able to correct her.
Yeah.
So
in New York State, the recommendation now is that all pregnant persons be screened every pregnancy. So Morgan would come up positive for hepatitis C in all of her checks and would have to be checked with a Hep C viral load to be sure that she had cleared the virus as per her treatment. The other point I wanted to recommend is that the recommendations around when you check an infant who could have been exposed to Hep C during the pregnancy and birth process has changed over time. So it did used to be 18 months. Before that, it was 3 years. So it has changed a lot over time. And currently it's between 2 and 6 months. So, and you do not check with an antibody because the mother's or the birth parents' antibody will persist in the infant for several months. And so you actually check it with what's called a NAT Hep C viral load, or PCR, which is a qualitative test looking for the presence of the Hep C viral load. So next, I want to talk about some action steps so we can leave our audience with some kind of things to think about, and also for providers who are listening to this, things to think about in their practice. So as you know, we have been making a Hep C and pregnancy toolkit. So the Department of Health and CEI are creating a Hep C and pregnancy toolkit to get the word out to persons of childbearing age about the importance of being checked for hepatitis C and also ensuring that providers are in compliance with the DOH Department of Health recommendations around this. So what do you think from a patient perspective would be important to include in that toolkit?
So the links that we talked about earlier, really, the information is kind of the name of the game. I would love to see links to things like this so that other people know that they're not alone. Part of the reason that I talk so much about it, and I think this is my fourth talk where I've talked about this, is nobody wants to talk about it. There's so many people that have gone through it, but nobody wants to talk about it. And that's the number one barrier, I think, to people getting care, especially people that need the care the most, right? So our homeless moms, our, moms that are in here, right, from other areas, pregnant moms that are in active addiction, and even moms that maybe hadn't had medical care. It's so important to know that they're not alone, that they're not less than, that they can be treated with respect and with compassion. So just kind of that, knowing that they're not alone and knowing that there's treatments. Again, I'm so glad I answered the phone for my doctor, because I never would have known that treatments, that I had the choice that to get treated during pregnancy. And I didn't know how sick I was. I didn't know how much better I could feel, and that I could have a successful pregnancy. I just had no idea, having had to go almost 13 years between pregnancies. I wanted it so bad. It was just devastating to think that I wasn't going to be able to have a successful pregnancy.
I think you're right. I think most people probably don't know that hepatitis C is easily curable with a once a day medication for either 8 weeks or 12 weeks, depending on which medication you take, but that they're well tolerated and they're very effective with almost all people curing of their hepatitis C. So we appreciate you being on here to get that word out. And then just to follow up again on the toolkit, what might advice be for persons who aren't yet pregnant that you would offer them based on your experience?
So if you're not yet pregnant, I will tell everybody that hasn't been tested, and I have told everybody that I know that had not been tested, get tested, because you can get treatments. It's widely available. And in my case, I had private insurance that wasn't going to cover enough of the medication, and the pharmacy that we were contracted with my doctor actually offered like a coupon. And so I think I paid $5 each for my 3 boxes of medication that I got. So if you feel like finances are a barrier, talk to your doctor, because there are options. If you have private insurance, or there are options out there, there's financial aid, and there are coupons that you can get outside of, GoodRx, but there are coupons that you can get if you're unable to afford it.
And also, just to be clear, Medicaid covers the medications for hepatitis C. And then for persons who are currently pregnant, what advice would you offer?
Don't feel ashamed. Don't just talk to your doctor and decide on your treatment course, but don't feel ashamed. Pregnancy it's such a beautiful time, but it's also a time that you're just filled with anxiety. At least to me, I was. But you see it with other people as well. There's a lot of unknowns. Take away this unknown. Don't leave it out there in the back of your mind where you're not going to enjoy your pregnancy as much. The how did I get here is not important. And I'm 3 years out from my treatment, and I care not at all about how I got here. I care that I got the treatment, and I have a success story. And if you're doing safe things going forward, then it's not going to matter what you were doing in your past. So it's going to matter, what are you doing going forward that's going to make the difference? So once you get your treatment, how are you going to move on? That's what's going to matter. So don't be anxious or feel ashamed or less than because of maybe some decisions you made in the past. It's the past.
Couldn't agree more. The other thing that I would just mention too, if a person chose differently than you and decided not to treat their hepatitis C until they were post, that you can still breastfeed with hepatitis C. So it is not a reason not to breastfeed unless you have cracks or splits in the nipple or in the area around the nipple. But other than that, it's very safe to breastfeed with Hep C. And then just lastly, before we close out, any last thoughts for our listeners? Any other messages you would like to get out there?
Giving reassurance, having compassion, and checking your assumptions at the door are vital and can make the difference of somebody continuing in care or shutting themselves away. So all of these feelings that they're having, these are valid feelings based on movies and media and news reports and all of these things that are put out into the world, that this is this, dirty disease that you get by, doing awful things and blah, blah, blah. Leave that in the 90s. We're in 2024. We know better. And we know that everybody is deserving of care. So the better that you treat someone and the more compassion that you give, the more people we're going to see coming in, getting cured, and, eventually, hopefully, just eradicating it in the future. Because the more people that go through this, the less people that are going to contract it. And that's what's important. We want it to go away. And we do that by compassionate care.
Thank you so much, Morgan. I completely concur with that and agree with you that most of the time we don't know somebody's story and we should not be making any kind of assumptions about them. And regardless of whatever somebody's story is, we should be treating everyone with dignity and respect and compassion. So thank you, Morgan, so much for sharing your story. I am sure that this will have a huge impact on thinking about becoming pregnant persons or persons who are currently pregnant and making sure that they access the care and testing that they deserve. So thank you so much for your time. Appreciate it.
Thank you so much.
Thank you for tuning in. Join us next time for a new episode of Conversations with CEI. Visit us at ceitraining.org and follow us on CEI social media platforms.